holding a patient or catching a patient or bringing it across your body. Anything that previously used to hurt, try it.
I have to think which way I would use it.
Probably that. Well, you're hooking
because I was
the
always holding with this arm, so they would go in
Okay.
that way. Because I always have this.
Then reach out with that weight. Swing it. Move your head at the same time.
Same head a lot.
Well, try both. So you just keep looking around, reach up over your head with the weight. There, okay, that's it. Just move my hand position to someplace else I felt was tighter. She felt the problem, so we get right to the problem. Up. Up and down, chin up and down. There you go. We want to free this area up the best we can. I think she's just, her whole break. Her whole brachial plexus is bound down in scar or fascial tightness, and we just need to loosen that area up. Okay, then you can stop. While she's resting, I'll go back and I'll evaluate the thoracic angle and see how that's doing. This one's a little bit forward, so I'll try to, the SC joint's a little bit forward, so I'll try to get that to the back. Little tight there. Be careful of me here now. Swing. That way. No, no. All's is not fair in love anymore. I always tell my patients that the only one that can hurt you is me. When you're in the clinic and you're doing your exercise programs, pain tells you that you're not supposed to do that. So you go right to it and work with it, and then work with the trainer, and then we'll try to work around the pain. Okay. Now which is the one that hurts you? Bring your head back and up?
Yeah.
Okay, let's do that a little bit more just to clear it out. Have I ever done this specific treatment before? Absolutely not. Every treatment is geared to the patient and their functional inabilities, trying to gain the function back. Stop. Head first. See how it starts to let loose, and then she's able to do some more. And each time she came back, I would retest this, add weight, up to 3 or 4 pounds, so that she can do what she needs to do at work and what she needs to do in activities of daily living without that pain. What's a good home exercise program? Yep. Good. There's one. About one?
Yeah. So I have to switch.
Okay.
Or am I hitting you okay?
No, I'm all right. Okay. No problem with putting microcurrent on there and ask her to do the movements? Any modalities that you favor? No problems with that. She also had a T4 and 4th rib, so I want to check that. How's the sensitivity back there?
It's fine this morning so far.
Yeah, yesterday, as soon as I touched it, she jumped.
Almost, she did. Almost.
I saw her headed in that direction. Got me down. Maybe. Good. Stay there. That's good. And I would still go back and check the soft tissue, do a little bit of movement with the soft tissue here, and use modalities on it. Okay, the next progression would be, I think her major problem is here, but the next progression would be to go into the subclavius, the axilla with movement, clear all that up, and then now we're going to start evaluating each nerve and going right down the line. I still think she has a thoracic visceral problem. Lie down with that. Yeah. I'm experimenting with an evaluation technique to tell me whether I should have to go into the thoracic viscera. It worked with her. It works with most people. I tried to find a muscle test or a muscle weakness situation that would tell me whether I have to check the viscera on this side or check it at all. And the only thing I could really think of is where you would think you would pull the viscera into play would be adduction. So if I resist adduction and I try to pull the arm out, if one side's weak and the other side's strong, side to side, that tells me I have to look for a visceral problem on that side of the body. So we'll just see how she does. Hold right there. Don't let me pull this. She goes right out. So something's telling me that from, at least so far with the experiment, from here out on this side, there's some tightness. And I think hers is right here. So as we get into the later on this morning, and we start treating the thoracic viscera, we'll most likely find a problem here that's pulling down on her shoulder. Okay? Thank you. We'll get to you again. So that was real good that we could see that sometimes you have to go in and do the high velocity, and then if you do your muscle test and she didn't drop as fast as she did before. She didn't hike her shoulder like she did before, but there was still weakness there. So you have to go back in and start from the beginning and start working out again. Okay, how about